Can I talk a little bit about palliative care,
Sure.
please? Because it is often claimed by some of my doctor colleagues, but also politicians, that just send them to palliative care, they'll look after them, they do a great job.
They do, and I agree. We should send all these patients to palliative care, and I always, if I can't demand that, but I would encourage these people, and I think that's probably part of your laws in Victoria and the proposals in Western Australia, certainly in the Oregon law, that all of these individuals should be sent for palliative care programs. I'm a huge palliative care guy and hospice guy. I just think it's so wonderful the help that they can provide. This voluntary assisted dying is a component in Oregon of palliative care. It's just a part of the process. It's not other, it's not different. It's an option, something to talk about. Very few people choose. However, the benefit of VAD for palliative care programs is just talking about VAD is palliative in and of itself. Just having that full conversation about all choices at end of life is relieving. I've been through this so many times where when the patient says to me, well, doctor, what about death with dignity? That's what we call it in Oregon. And I say, okay, let's talk about it. It's just this relief in their face, in their body movements, that really we can talk about this. And that's palliative, and it's part of palliative medicine. But yes, I think I agree with that person who says, send them to palliative care. Palliative care is really wonderful. Sadly, not 100% of the time can palliative care teams relieve terminal suffering. And that's the enemy here, is terminal suffering. That suffering near the very end of life that the patient defines, that is not solved by any of the things that we and our wonderful palliative care doctors can do.
Can you tell me a little bit more about that? This is a really important issue for us. I regard palliative care as a treating physician exactly the same as you do. They're my colleagues, and like every other medical specialty, they have their place. They also have their cases where they're going to be unsuccessful. Occasionally I've met patients who don't want to be referred to palliative care for one reason or another, despite adequate disclosure about what palliative care can offer.
Right.
They're the minority, I have to say. But tell me about cases where the minority, where palliative care isn't successful, isn't able to relieve suffering, and the patient is left trapped.
Well, there are too many of those because, well, you know, if there's, we're all going to die, and so there are many, many stories to be told. But I've had conversations with palliative care doctors who disagreed that aid in dying should be an option. And one example that I would provide, if I could be a little graphic, but I would have to be at times, was a woman who was not a patient of mine, but was a patient of a peer of mine in a nearby community, who had a vaginal cancer. And so she had been through surgery, she had been through chemotherapy and radiation. Wonderful things to help her for a while, but the consequences of those treatments gave her fistulas, which are connections between the vagina, the colon, and the bladder.
And the skin.
So she was then having discharges of the biological products that were terrible. We couldn't handle all these things. And she felt like she had the flu all the time because of the chronic inflammation that she was having. So she kind of felt sick all the time. She had a lot of pain, but the biggest problem were the discharges and the consequent odors. She did not want her grandchildren to visit her.
Right.
I can't imagine that. I have 7 grandchildren, 5 grandchildren. I don't know how many grandchildren I have, but it's unimaginable that we'd be in a situation where you couldn't have your grandchildren come to visit you, because nothing that the palliative care team could come up with could resolve all of these symptoms, not just physical, but other things too. And so she was a woman who chose aid in dying and had then a peaceful death. But her last months before she chose that were about as bad as anything I've ever seen.